any particular religion or some kind of belief or thoughts ki, okay, this is I'm this sort of person, only then can I practice mindfulness. It is totally secular, and that is why actually it has spread all over the world. The roots of it is in Hinduism, Buddhism, but it has been taken all over by especially in Europe and USA, because it is so secular and can be done by everyone. So before I talk to you about mindfulness, I'd like to just break down the meaning of mindfulness with a few sentences which can highlight it better, because I know it is not something which is new to any of you. Now, the definition as given by John Kabat-Zinn is that mindfulness is being purposefully aware of the present moment as it is, without any judgment. Now, when we first hear this definition, many of us would think that what is so special about being aware? All the time, right from the time we wake up to the time we sleep, we are aware. If I'm giving this talk and you are listening, you are aware of it. And whatever activities you're doing, it is with awareness. So what is so special about being aware? So most of you will agree with me when I say that we spend a large part of our lives in a kind of a automatic, autopilot mode. For example, many of you, the time when you started learning to drive, and initially every moment we had to think, this is the brake, accelerator, and clutch and everything. But after once you got the hang of it after a few weeks or months, then most of the time you just you switch off the ignition, and then before you know, you have reached your destination without really being aware. So in mindfulness, we are actually bringing awareness to all our movements and all our thoughts and sensations, whether it is within and without. The famous Buddhist teacher, Pema Chodron, many of you may know, she once was giving a talk and she said that a large part of our lives, and for most of the people, it is true that we have this much awareness, so that if we are walking along a street, we don't fall into a manhole, but we don't have the awareness probably to even notice what is there a block away. So we have this so much of awareness with us that, okay, we don't really fall into any kind of difficulty or danger. But other than that, we spend a lot of our times in a automatic, autopilot mode. So mindfulness is bringing awareness to our daily action. And another important thing we notice when we start being aware is how often we are in resistance to the present moment. Most of the time we feel that this moment is not completely enough. Something is lacking here. Something could be better off. It could be the temperature, the surroundings, the place, something could be better. So, and also we treat each moment as a stepping stone to some other distant moment. For example, if maybe you have some meeting after this or something, some other satsang or something, then you feel, okay, yeah, let's get over with this talk and then I'll go to the next. Or if suppose I'm doing some work, then my mind is immediately, okay, what is the next activity I have to do, and so on. So as Eckhart Tolle, the famous writer, says, we often treat this moment as an obstacle just to get over with it. And in mindfulness, actually, we are treating each moment as an end by itself, rather than just as a means to an end. And when we are being non judgmental, we are not resisting the moment. It may not be to our liking. Something is happening. Maybe I'm in pain, or something is happening. Someone has said something. I may not like it, but I am not resisting the isness of the present moment. It is the way it is. And that doesn't mean that we can't change anything about it. Of course, if there's some illness or something, then I go to the doctor, I show, and whatever medications I have to take, I will take it. But it is futile to resist it, saying that, oh, why has this happened to me? I am so health conscious, or I'm a doctor, and how can this happen to me? So that is what the definition means, that being aware of the present moment as it is without any judgment. And the third important component is that mindfulness is an embodied presence. We often spend a large part of our lives in the upper story, in our thoughts, in planning, in doing, in thinking. Even when we are, spiritually inclined, we have a lot of thoughts. Okay, it'll be so nice if I become enlightened or even become more advanced spiritually or whatever. So we lose touch actually with our body. Our body has a lot of wisdom, and it always grounds us to the present moment. In like there's a famous novelist, James Joyce, who talks about a fictional character, Mr. Duffy, saying that Mr. Duffy lives a short distance away from his body, because implying that he's mostly in his mind, and that is what it is for many of us. And as I would say an academician, as a doctor, and I've seen many professionals, the more technically or academically inclined we are, we tend to become more centered in our minds, and it's always about thinking. We rarely, in fact, the body, we can say it is used as a vehicle to transport us from one place to another, and only when there's some illness or disease do we really come back to our body. And in mindfulness, it is an embodiment where it's an invitation actually to come back to our body, to come back to the present moment. And in the practice, what we are trying to do is to become as present as possible, grounding ourselves and anchoring ourselves to what is here right now. So this is a little about the explanation of the definition, and just a few lines about why we need to do mindfulness and how it can help in our lives, in what ways. So I would say the first thing is the gift of the present moment. you know Mindfulness is of course being present, and as the saying goes, it is actually a present to us, because by being present and aligning ourselves in the now with what is happening, there is a sense of aliveness and joy and harmony. Again, everything externally may not be the way we desire it to have, but when we can all remember the times when we have been at our happiest and most fulfilled, it is when we are present and in the moment. So the more we practice being mindful and being in the moment, the more we give ourselves this gift of well-being and harmony. And the second important thing is space. So space, there is increased space between our thoughts, between words, and there is some what I will call inner spaciousness. The more we become present and mindful, there is there appears to be much more space to maneuver things. There's a wonderful saying I'm sure many of you may have heard from Viktor Frankl, that between any stimulus and response there is a space, and in that space lies the power to choose our response, and in our choice lies our growth and freedom. So between the stimulus and response, there is space. In that space, we have a choice, and in that choice lies our growth and our freedom. So that, I would say, it summarizes what mindfulness is all about. And the more we practice being present and being in the now, we find that this space increases. Tara Goldman, in fact, she calls it the magic water second. And that is what I have seen, because it may be just a fraction of a second more space. Someone says something. Like the other day, I would say one of my technicians in endoscopy room said something a bit, flippantly and very casually, which kind of, just I thought this was not the right time for him to say that in front of a lot of people. Immediately there would be that response to, cut him short there and, just put into place. But there is that space which gives you time to maneuver, and you feel that, okay, this is not the right time. So after the meeting was over, I just gently called him and said, this is not something which you should speak in front of everyone, you can just tell it to me. And the thing was just dealt with over there. But suppose if I react at that time, then he reacts. It creates, a very hostile atmosphere. So this is about that space. Then in creativity, mindfulness has been a very important tool, and we all creative in whatever way. We may not always be painters or musicians. The way we talk, the way we speak, the way we may just be writing. We all creative people. And again, we can realize that we are at our creative best when there is that stillness and presence. And in fact, one of the forms of mindfulness, which I'll be touching about, which is an open awareness method, it has been found. There are a lot of studies which I also share in my book, where the more we use these methods of mindfulness, the more creative we become. In sports and all kind of sports, whether it's cricket or athletes, I'm sure many of you may be very fond of sports. It nowadays, especially like there is the NBA basketball team, the coach Phil Jackson. He's a proponent of mindfulness, and he used it. And in fact, he won around 6 or 7 consecutive titles for his team. And in fact, he's written a book also in which he mentions about it. In any kind of, whether it's basketball, cricket, football, we use it. I'm sure many of you over here may have watched the India Pakistan match T20 last Sunday. And if I think one picture which must be imprinted on a lot of people's mind is when Ashwin was facing that, there were 2 runs and 2 balls. There was that ball from, Mohammad Nasir, and very coolly and with a lot of presence, he just left it rather than scrambling for his bat, and it went for a wide. They got an extra run, an extra ball, and the next shot he, got the scoring runs. Everyone praised him for his presence of mind. And what is his presence of mind? Nothing else but mindfulness and just being in the present moment. So sports it has been very widely used, mindfulness, for sports. Now I'll talk about health and disease. As a gastroenterologist, I can vouch for it that a lot of cases of irritable bowel syndrome and dyspepsia are due to anxiety and stress. I would say 80% of the patients who come to me in my OPD, they have some kind of anxiety and stress, and because of that, it is a kind of a psychosomatic response. And in fact, I started these sessions, giving classes by like I would tell my patients that, okay, why don't you practice mindfulness or some kind of meditations? And they would come to me after a couple of weeks saying, doctor, it's so confusing and I'm not sure what to do, there's so many things. Then I would just give them small tips, call them in 5 or 10 groups and call them and give them, and they found it quite helpful. So that is the way I started giving these classes. So in all, and it's not just about gastro and cardio, neuro, whenever and you'll all agree that most of our stress and anxiety is because of these stressful thoughts, and which always pull us away from the moment. And when we are there in the present moment, we are able to deal with the situation. So in health and well-being, it's an important thing. And of course, from a spirituality point of view, I would say mindfulness is a very nice bridge between the material as well as the spiritual. In fact, I remember when I started reading The Power of Now, which many of you have read about from Eckhart Tolle, and he never uses the word mindfulness in that. He always uses now or being present. So, but he's talking all about mindfulness. So that time I was not really interested in much in spirituality. I just wanted to, simplify my life, and all this chaos and clutter, I wanted something which would help me. And then he would always, every sentence of his would point to just come to the present moment, just see what is happening, what is there in front of you now, what can you do right now. And then once you become present, then you get access to that beingness and presence, which I'll talk a little more about shortly. So this is all about why the benefits of mindfulness and why it can be so useful. So now I would talk a little about how to do it, because of course I know that most of you are seasoned practitioner doing some kind of meditation. the practice which I'll tell you is very simple, and I like it. And most of my, the people who I teach, they like it because, as I said, it is very secular and can be done anywhere. A formal meditation may require kind of a secluded place or cushion or something. I do most of my practice when I'm sitting, maybe in the OPD. I get 2-3 minutes, or wherever you like while commuting in the metro, or like when I'm in the car behind, just sitting behind, then I can use it. So the practice in this, we use either our breath or any of our senses as an anchor, because the breath is always in the present moment. So that is the most common anchor we use. Or we can use any of our senses like hearing, seeing, tasting. I'll also guide you to a little about listening, because it's a very useful practice. So what we do is, we just sit wherever we are comfortably, and we feel our breathing. Now, the breathing, wherever you feel it more comfortably, it can be through the nose, the breathing through the chest, or the abdomen. Simply, we just follow the movement in and out. I'll be saying in out, but you can count your own whatever you're doing. And it's not a very concentrated this thing, simple following in and out. What do we do about the thoughts? Because that is a hindrance for a lot of people. So here the Zen master Suzuki gives a wonderful quote that, leave your front and back door open, let thoughts come in and go, don't serve them tea. So we allow thoughts to come in, because many people, especially the people who I guide, they have this thing that there's this kind of misconception that when we are practicing meditation or mindfulness, we should have absolutely no thoughts, and if thoughts are coming, then something is wrong. Not at all. Thoughts may come, you can allow them to go. The only thing is, when you're distracted, you just come back to your breathing. Don't suppress it, and neither do we chase thoughts. So this is the simple practice. We'll do it for 5 minutes. I hope I'm audible and everything is clear.
Yes, yes, very audible and it's clear.
Okay.
Thank you.
Thank you. So, okay. So now, just before we do the, practice with the breath, I'll just ask you to do a simple body scan, where we are just bringing our attention from the top of our head to the toes, to each part, simply being aware of each part. So this actually brings us again back to the body. So you can just relax and sit wherever you are, in whatever position. We'll do it for maybe 5 minutes. I'll guide you. You can close your eyes. I think that may be easier, or you can leave it open. There's no problem. Take a few seconds just to acknowledge that you are sitting. It sounds strange, but very often we do things without even being aware. So wherever you are, take a few seconds simply to acknowledge that you are sitting in front of your phone or mobile. It's around 7 o'clock in the evening. Feel your clothes against the back of the chair or sofa. Feel your body sitting. Feel your feet against the ground. Simply being aware that you are sitting. And now we just bring our awareness from the top of our heads to the toes. We bring our awareness to the forehead, eyes, cheeks, nose, simply resting our awareness to each part, bringing a soft smile to our lips, coming down to the chin, bringing awareness to the neck and shoulders. We often carry a lot of tension in our shoulders, so we just give it a massage of awareness. Then we come to our hands and our fingers, just being aware of our fingers, maybe being aware of the gap between our fingers, coming down to the chest, the heart area. Sometimes we can just keep a hand over the heart. Then we come down to the belly, down to the pelvic area, bringing awareness to our hips, thighs, coming down to the legs and the toes, being aware of the space between our toes. And now we can just flood awareness throughout our body, just being aware of our body sitting. And now I invite you to bring that same awareness to your breathing. Wherever you feel your breathing, just breathe simply out, in, out, being totally comfortable and relaxed. Let thoughts be there, let it come and go. If at any time you are distracted by thoughts, you can again come back to the breathing. The breath always brings us to the present moment, never in the past or in the future. And there is no right or wrong way to do the practice. Whatever you're doing is fine because you are doing it in awareness and simply being with yourself. In, out, in, out. At any time, if you want to cross your legs or change your position, you can do it simply with awareness, letting whatever sensations or thoughts, letting it just be without any judgment, without thinking, why is this sensation here at this time? Why is this emotion here? Just simply being as it is, coming again and again to our breathing, in, out, in. When we are practicing, we are simply coming back home. And it should be with that kind of comfort that we do the practice, that you're just coming back to yourself, coming to your body, to your breath, to the moment. Whatever thoughts or sensations may be there, we can just allow it to be, being completely relaxed without any thought whether this is right or wrong or how is this going to help me or not. Simply remaining as you are. From time to time, there may be distractions, and we just bring ourselves to the breath, in, out, in, simply. It is a very simple technique which can be done anywhere. Just anytime there is restlessness or agitation, just bring ourselves connecting with the breath. In, and now slowly you can just maybe rub your hands together with awareness and bring it over the face and open your eyes if you want. So this is the, as you can see, a very simple practice which can be done anywhere. And I'll talk a little bit about when to do or how to do. And I'll just follow this with a short 2-3 minutes. As I said, the most commonly used anchor is the breath, but we can always, you use various other anchors. And I have found personally that sounds are a very useful anchor, because especially when I'm going to the hospital, while sitting behind, there's the sound of traffic, signal, FM, noise. And earlier it used to bother me and irritate me sometimes. But once I learned that this can be used as an anchor, that itself brings us to a still point. So it's the whole process is similar. And only thing is, instead of being aware of our breathing, we just be aware of all the sounds, not the quality of the sounds, not ki this is harsh or soft, or what is the person saying, or what am I hearing, just the hearing per se. Okay, so we'll do it for 2-3 minutes, and then we'll have some questions about the practice. So simply be totally relaxed, acknowledging that you're sitting. And I invite you just to bring your awareness to all the sounds that are there in your vicinity, simply being aware of it. Not, again, there is no straining or concentrating hard, simply being aware. It can be the sound of my voice, the sound of your breathing, the sound of the fan, maybe a dog is barking, someone talking outside, blaring of the horn, simply being aware of it. Thoughts again may come and go. Sometimes we think, oh, this is so disturbing, distracting. No problem. Just bring your awareness and attention to the sounds per se. As you can see, whenever we are commuting, traveling, we encounter so many sounds, and this itself can be a very useful grounding way. Whatever sounds are there, letting it remain, not judging it for what it is, simply being aware. Whatever thoughts or sensations are there, you can just allow it to be as it is. Just being totally relaxed, aware of all the sounds. And now I would ask you to let go of the sounds also. Just be aware of whatever is happening. So it can be sounds, your breathing, anything in the distance. Just simply stay as you are, just being aware. So this is what we call the open awareness method, where you are just sitting in awareness, as awareness, allowing whatever sounds, sensations, thoughts simply to come and go without any agenda, without any particular goal. This can often be, especially when we go for our morning walks in the park or wherever, the birds chirping, so many smells, so many things. You can just take a few minutes and sit wherever we are in awareness. And this can be a very soothing kind of. And now again, you can slowly open your eyes. So this was about the practice. One, we are using the breath, then sounds, and also a kind of open awareness. And now, if there are some questions about it before I talk about some other one or two topics, I would invite you, because if you can share your experience or whatever you would like to about it.
Thank you so much for that. And now, if there are any questions, kindly unmute yourself and ask Doctor those questions. Any questions?
Any doubts or difficulties, whether it was
Hello.
easy to follow or difficult to follow? Yeah, hello.
My name is Ravi Prakash, and I have a simple clarification needed.
Yeah, sure.
This power of present moment awareness, and even if I just think of a future plan, that is also in the present moment. Is it not? How anyone can, it is nearly impossible for any of us to be getting away from the present moment awareness. Is it not?
Yes, very, very true. Whenever we are making any plans, of course, that is in the present moment. Now, what we just need to understand, making plans or planning for the future, there is obviously no harm in it. Not only no harm, it is important. But what we fail to often realize is that often most of the time we are in the future. Suppose if now we are sitting and if there's a meeting after this or something important, we know that, okay, there's some important meeting. Or suppose if I'm sitting, there's a meeting after this, after 1 hour, I know that I've made my preparations and all. But by habit, what happens is if I'm sitting, then my mind immediately goes, oh, there's a meeting there or something, or some guests are coming, and we keep on actually drifting to the future. So in this practice, or in the process of mindfulness, there is no harm at all in planning, and there is a time where you plan, but we don't need to plan all the time. That is the whole thing. Whenever we allot those times, yeah, we have to plan, we have to make, for example, tomorrow I've got my hospital, there are so many things I have to do, some endoscopy, some OPD, some round patients. But at every moment when I'm aware and when I'm with, suppose, my family or this thing, then I don't need to really think all the time. If there's something particular, I allot a few moments and I think about it, and then I go and do whatever activity I do, being present. That is what I say.
Okay. The other thing I just really want to know is how being in the mindfulness or being in the present moment awareness can solve the gastroenteritis problem,
Yeah. See, it's not just about gastroenteritis, it's about any kind of illness, because a lot of, like, for example, I can talk from a gastroenterology point of view. Like, you may have heard of irritable bowel syndrome or gastritis or dyspepsia. Now, there has been a lot of research which has shown that a lot of it is associated with anxiety.
Yes.
Anxiety and stress. So the practice of mindfulness, there have been a lot of studies also, has shown that because this practice, it helps you, align yourself in the present moment, grounds yourself, makes yourself centered. So there's that feeling of well-being. And this decrease in stress is what helps in the disease. Because, like, when, for example, a lot of patients, not many will go for mindfulness or meditation, but they agree that they have a lot of stress. So ultimately what we end up doing is to give them some anti-anxiety or anti-stress medicine. And once that helps and that reduces the stress, then they are fine. So this is one of the ways, which it can be mindfulness meditation, any kind of meditation, which actually decreases stress. And once stress and anxiety comes down, that actually it decreases whatever illness it is, be it gastro or even cardio or neuro. I'm not talking about the organic disease. Of course, organic disease is different. That requires their own medication. This also requires medication, but the primary problem is in the stress and anxiety.
Thank you. Thank you very much.
But this stress and anxiety is basically in the subconscious. No?
The origin is often in the subconscious, but it is manifesting in your conscious day-to-day living. And we can agree that a lot of our stress and anxiety is due to anxious thoughts and anxious worries. For example, during the COVID time, now everyone, most of us, whenever I think, or I would say 95% over here would have had COVID one time or the other. So when we had it, we got our treatment, we went to the doctor, we got our test, and finally, some may have it mild, some may have, a more severe form, but we all got, treated, and we dealt with when it happens. So when things happen, when they eventually happen, we can deal with it accordingly, whatever has to be done. But there was a lot of panic and anxiety at that time, and forever is about, okay, what will happen if my family gets COVID? What will happen if I get COVID? What will happen if I fall ill? What will happen if I get shifted to the ICU? So you see, all these thoughts are because of future worries and anxieties. And the more we become present, then you're dealing with what is here right now. And it's not just about COVID, for anything. For example, I know a lot of my patients come, especially some elderly people. Doctor, my children are away. We are only, couple staying here. They are abroad. So I always worry, what if I, have this illness? What will I do? What if in the middle of the night I get? So I tell them that, see, you have to understand now, you make your preparations case. If suppose there's some emergency, have those emergency numbers to call, people to help, do the practical things. But if all the time you're thinking about what will happen, then definitely that will, manifest in some way or the other on your body. So you make all preparations, do whatever. Okay, I have to, if suppose something happens at night or something, where do I have to go? What number do I have to dial? And then just be with what is happening right now. If the disease has to come, then it can be dealt with at that time. But why just spend a lot of our present moments in the future? That is what the thing is about.
Thank you, sir. And I don't know whether the right time to ask this question.
Yeah.
People offer 1 week program, 1 month program, and some 6 months program on mindfulness and all. Is it really necessary like that?
It's not necessary. But it can help a lot. So what happens is, like all these retreats and all, the purpose is that actually very often when people start any practice, be it mindfulness or meditation, then because there's so much of distraction, maybe in their house or in their minds, that they can't really start practicing it. And they often they start for maybe 1 or 2 days, then they get distracted, then they think, okay, it's not helping. So sometimes these retreats or 2-3 day practice, it kind of sets you up for and gives you a taste of it, and then you can just practice at home. But I would say, if we start this practice, like what I recommend to most of my students is simple practice. You do it, you start with, I ask them to start small. Do it maybe not, you don't have to start with half an hour. Start maybe 5 minutes a day. What I ask them, what is the time you can afford? If it's 5 minutes, you start with that. If it's 10 minutes, that. If you can give a longer period, then it is definitely much better. I would say you start with a particular time, maybe in the morning or evening, wherever you're most comfortable, in a particular place, just to create those vibrations. But the thing is, you can do it, as I said, whenever I'm in the office or traveling, you can do it anytime. The more we practice, even these short minutes, 2 minutes, 3 minutes, we shouldn't underestimate that. The more it helps us, practice in even difficult situations.
Thank you, sir. In fact, since you mentioned India Park match, 40 overs and 3 hours, we are totally mindful. At least I was totally mindful.
Absolutely, absolutely. So, and you see, at that time, whatever, even if India had lost the match, we would have felt quite happy, because whenever we are present, then we are not lost in our minds and thoughts and all. And that is why actually, why sports or movies or entertainment, why does it continue to captivate people and draws the crowd? It is because during those 2-3 hours are we are completely focused. So actually, it's in many ways that is also a indirect way of practicing mindfulness. The more we are just totally, when we are watching a movie or a match, then we are not really thinking, okay, tomorrow what is going to happen, or this is we are not lost in our worries and all. We are just there in front of the screen.
Sir, with your experience, can you just suggest what is the prescribed duration for practice to attain some sort of a stability initially? The mindfulness, this thing.
Practice. So what I've seen is that I would say 20 minutes a day is very good. 20 minutes, if we can do it twice a day, I think it will be even better. Now I'll share it with you my experience so that you'll. Now when I started practicing, I started initially with 10 minutes. That is all I thought I could afford. 10 minutes was all. So when I started doing it after a month or so, I found that it was helping me in every way. My work, family, every way. So I wanted to do more. Then I would just increase 15 minutes. Now that also, after some time, I thought it'd be lovely if I can give myself half an hour. So the only way for me was to wake up 15 minutes or 20 minutes earlier. So I started doing that, and slowly, since the more I did it, the more I got the taste of it, the more I found it useful. I now, for example, I do it almost an hour a day, at least in the morning, and some in the evening, maybe half an hour, 45 minutes, depending on my schedule. So, and the only way was to wake up earlier. So I used to earlier wake up at around 6:30, 6:45. Now I wake up at 5:15. And mind you, almost every night or every other night, I'm disturbed by at least minimum of 2 phone calls at 12 or 1 in the night, or sometimes even more. But I've seen that the more I practice, the quality of my sleep has increased. It has increased, and I require even less sleep, because this practice itself is so nourishing and soothing. So it makes up for that lack of the number of hours of sleeping. So I'll say, when we practice, when we start initially, I would say 20 minutes is good enough. But for those who find starting, especially the professionals who are quite busy and all, I say, just tell me, or just tell yourself, what is the time I can afford right now. Do it for 5 minutes, do it for 10 minutes, and once you start doing it, you develop the taste, and then you yourself will be able to find time. No one has to tell you to create more time.
Sir, thanks a lot. I have a final question. Do
Sure.
you have case studies to say that on account of somebody practicing this mindfulness, has he got rid of the psychosomatic disorders like BP and diabetes and things like that? Would it help?
Yes, definitely. Now, is, like I would say, BP and hypertension is not strictly psychosomatic, because there are a lot of genes involved, a lot of other things involved. So that is not, but stress and anxiety aggravates it. So there's a lot of studies showing that mindfulness practice has, in fact, the requirement of your medicines for blood pressure and sugar has come down a lot. And in fact, in some cases, it has totally disappeared also, because in a lot of cases, it is just the stress and anxiety which can cause blood pressure and sugar. So that part, once it is dealt with, some people don't need medicines, but even those who need the amount, maybe if it is 3 tablets, it comes down to 2 or 1 or whatever. And there are enough studies for all kinds of diseases, because I will not say that you totally stop medicines and just practice. It has to go side by side. And in fact, one example which I had shared in my book is about my driver. He's a very competent person, but he had a lot of anxiety attacks and panic attacks and depression and all. So he was on a lot of medications. Sometimes he would suddenly have panic attacks and had to be admitted for 2-3 days and all. This was going on. He was on many antidepressants and anti-anxiety. So I was talking with a friend of mine over the phone. He overheard me. I was talking about mindfulness and meditation and all. So he asked me, hesitantly, whether I can just guide him. So frankly, I didn't have much hope. I thought, I don't know what he'll be able to do, but I just told him the simple practices. You do this for 5 minutes or something, and then we'll see. And then after a week or so, he came smiling and said, I'm doing it regularly for 10-15 minutes. It's helping me a lot. So I said, very good. Then you keep on doing, try to find out, get more time. After 2 weeks, after a month, he said, yesterday I meditated for 45 minutes. So I was really, astonished. And now the thing is, he was earlier on, I would say, 5 or 6 different medicines. He's still on some medicines, but the amount now he's on, maybe I would say 75% less medicines than he was. And not only that, his overall, his well-being and his anxiety and all has reduced so much. He himself says that my family, leave alone my family, I can't recognize myself from what I was many years ago.
Thanks a lot for the assurance, doctor. Thanks a lot. It is indeed a great assurance.
Thank you so much. Okay, so shall I proceed with more? So Sajani, how much time do we have more?
Yeah, easily another 15-20 minutes.
Okay, so I'll
minutes.
talk a little more about 5-7 minutes, and then again we can have some questions or interaction. So what I wanted to talk about, one is that mindfulness in our daily activities. So as John Kabat-Zinn says, that the real meditation or the real mindfulness is how we go about our daily lives. Once we are, get off from the cushion, then how are we, dealing with life? That is the real meditation. Because very often we have seen, and this is what used to happen to me before. I would spend, maybe 20-30 minutes meditating, feeling very good, and immediately when I would get in the car and there would be a lot of traffic lights and I would be held up in traffic, then I could see myself getting agitated and restless and all. So how do we transmit that practice into our daily lives? And so for this, there are a lot of occasions where we can practice mindfulness right from the time we wake up to the time we sleep. So when we wake up, when we are brushing our teeth or just cleaning our face, we can mentally just say, like brushing or washing. What happens is that just mentally telling ourselves brings us back to the present moment. Maybe when we are groggy and sleepy, we can't really be fresh. We can't be totally present. But just the fact that rather than blindly or just, brushing just without any awareness, we just simply say brushing, cleaning. Then when we are cleaning our hands, simply feel the sensation of water on our, hands and the feeling of soap. Like as a doctor, I keep on washing hands between patients. Sometimes when I'm lost in my busy schedule, when I come and clean my hands, that half a minute itself, just feeling the sensation of water, that helps me come back to the present moment. Then when we are having a bath is a very wonderful way of being present, because with the sensation, there's a lot of sensation, soap, water, the feel of our body, so that can bring us back into the present moment. And especially when maybe in the weekdays I don't get much time, I'm in a hurry, but in weekends you can spend a little more time having a nice luxurious bath, savoring it. So that can be a very good portal into presence. Even when we are changing our clothes, it is very often just automatically we wear our clothes. Now there also we can bring presence. Just when we are buttoning, we can say mentally buttoning, or putting the belt. And I would say sometimes I'm in such a hurry, but even when, if for example two buttons if I put in awareness, that also breaks the spell of this mindlessness. And anything which we do in presence, it breaks that spell and brings us into presence again. Then during like the Mr. Jankiavan, I think, talked about mindful eating. So we always have a breakfast, lunch, dinner, and snack. So that is a wonderful time again, depending on how much time you have. Maybe if you are busy, you can maybe one meal a day. For example, I try that during dinner when I'm a little more relaxed, I try to be more mindful while eating. So, but if it's possible during each meal, just kindly just sort of feel the sensation, chew it, feel yourself drinking water, feel the sensation. That not only helps us savoring the food, enjoying it more, eating less. That is such a important thing, because whenever we eat mindlessly, we are eating more because we are not aware, and the signals from the brain to the stomach takes around 15-20 minutes. So when we eat in a hurry, we eat more, and when we are slowly eating, we are allowing those signals, satiety signals also to come. So whenever we eat, we can become more mindful. And the mindful teacher Meera Srinivasan talks about the 4 T's which we can do in our daily activities. So that is, which all of us use it somewhere or the other. 1 T is for tea or coffee, then toilet, transition, and telephone. So tea or coffee, we always take tea or coffee breaks. So whenever we are having a tea or water, that can be the cue just to come back to the present moment. Because anyway, we are having a tea and coffee breaks. We can just take those few minutes. And sometimes just sitting in the morning with tea in awareness, if we can spend even 5 minutes or maybe 2 minutes, even less, that can be, you can see the difference you feel from within when you are drinking your tea or coffee in awareness. So that is one. Then telephone, all the time we are logged on to our phones or Facebook or social media. Maybe that can be a cue for us whenever there's a notification, or we are just the feel of the phone can be a anchor, and it can be a cue to bring us back to the present moment. Then toilet, whenever we are using the washroom, as I said, cleaning hands, feeling the water, the soap, that can break that activity of mindlessness. And the fourth is transition. So we are always in transition. If now I'm in front of the computer, then I'll go to the other room. Say in my hospital, when I'm in the OPD, then I go to the endoscopy room or to the this thing ward round. So during that transition period, that is again a signal. Okay, maybe for some time I've been lost in the work or patients. Then I bring myself back to the present while walking meditation or walking mindfulness is a wonderful way, especially maybe in your morning or evening walks. You can just be totally present, be just tune into all the senses. Whenever we tune, as we have seen, hearing is such an important part. So when we are present, when we are walking, just simply tuning, being aware of the steps, the feel of our foot against the ground, the sound of the bus, the horn, the birds, the trees, the smell, all these things, they help us. And the more aware we are, the more we feel that sense of joy and well-being. And telephone, yeah, so these were the 4 T's. So this way each of us can create our own schedule. Whatever we are doing, we can make some moments of mindfulness. And again, we can create pauses in our lives, small gaps. For example, like whenever I, like as I said, I travel in the car. Whenever I'm about to reach a destination, whether it's a clinic or the hospital or my home, I just take maybe a minute, just sitting, being aware of my back against the rest, my feet against the ground, simply. Or when we are waiting in the elevators, rather than again aimlessly scrolling over the phones, we can just connect with the breathing, just being aware, or just connecting to our breath. Because we spend a large part of our times in waiting, whether it is for the elevator, waiting during the traffic signals, waiting in lines while shopping. These are all moments where we can create those gaps and those mindful pauses in our day-to-day lives. So each of you can create your own ways to bring more awareness and presence. And the last thing I'd just like to touch upon is presence. So we have talked about mindfulness and that being in the present moment. So Eckhart Tolle talks a lot about presence, which is it. When we are totally in the present moment, we gain dimension to that state of what we can call maybe beingness or state of aliveness, which he calls the unmanifest. And being in the present moment is one of the portals to gaining access to that presence. It's not the only portal. He gives a list of around 5 or 6. One, he talks about the inner body, just feeling ourselves from within. That also helps us gain access to this formless presence. Then he talks about space. When we are aware of spaces, say the space in the room, the space in the sky, space around us, that actually increases our inner space, and that gives us access to that formless presence. Silence, he often recommends just paying attention to silence, because every noise emanates from silence. So when we are just aware of silence, when we are aware of this external silence, there is a growth of that internal silence, and we are aware of that state of presence. Any activity which stops the mind. So as Mr. Janki Raman was saying, he was for 2 hours, he was totally absorbed and not thinking. So that state again, anything which stops the mind brings us into the present moment. Sometimes it can even be a fraction of a second, some joke. When someone cracks a joke, then our mind is suddenly still. Then also we actually unknowingly we come into presence. And the last which he talks about is a state of surrender, when you totally become non-resistant, that state of non-resistance and complete acceptance. Maybe the situation is totally traumatic or chaotic, but you surrender to this moment as it is, because the moment is the way it is. In that state of surrender and non-resistance, we glimpse that state of presence. So these are the ways in which we can gain access into that state of presence. So I hope you all enjoyed or found it useful. And now again, I would whatever or whatever you would want to.
Yeah, this is Aparna here. Regarding acidity in a young person, especially which happens often, could it also be related to stress and anxiety?
Oh yes, because we are getting a lot of patients, especially during starting from this COVID time, young patients, because now earlier acidity and all was considered a illness of the the once you reach middle age or old age. But now one is the eating habits have totally changed. There's a lot of processed food, lot of junk foods, easy availability in Swiggy, Domino's and all. Then lack of exercise, that is one thing. And of course a lot of pressure on the young students, especially all kinds of pressure to perform studies, this that. So a lot of this is we are seeing a lot of acidity and all. So of course again, don't, I won't say ki assume that everything is because of anxiety. First of all, try to change whatever eating habits, especially skipping meals and all, try to change that. But even and some exercise and all, even after all that, if things don't improve, then show the doctor and get all whatever tests done. But to your question, definitely in children we see a lot of anxiety and stress.
And in older adults,
Yeah.
mid-30s and all that, why is it that some people can handle skipping meals, but others cannot?
So I would say it's a kind of uh, a gift to each person. So because I often also, because I have had this battle with my weight since a long time, so I do intermittent fasting very often, and it helps also. But sometimes I also find that there's a lot of acidity. So but because when I find intermittent fasting helping, so I just take the antacid along with it and I continue with it. A lot of patients have come, and for many patients, whenever they do fast for either breath or whatever, they immediately have acidity. So I say, if it is very important, then of course you do it, you take your antacids and all. But of course say if it's once a month or something, then there's no harm at all. But if you're doing it very regularly, weekly, and you're having a lot of problems, then I would say you can maybe tone it down or cut it down. So everyone's disposition is totally different. For some,
Thank you.
they may handle it very well, and for some, even the 4 or 5 hours gap between meals can trigger acidity.
Thank you. Thank you so much.
Any more questions? Kindly unmute and ask doctor your questions.
I think we can learn a lot of mindfulness from young children. They are totally absorbed in what
Very,
they do.
very true. Absolutely. Absolutely. Because they are totally, present and mindful. Young children and pets, both. We can see the pets, like I have also a dog, and I see, at times he's so totally present, still aware, because nothing is going in his mind. No, okay, what do I have to do after this? And then he'll just respond to that moment. The same with, as you said, with young children, they're totally present. At one moment they may be crying and saying, I'll never talk to you again or something. Next moment they are happy. So they are just responding to what is happening right now. So as you said, they can be our best guides, both pets as well as children. They can guide us to being living a more present life.
Any other questions?
One question is, when is your book planned for publication, sir?
Oh yeah. So thank you for asking. So that, as I said, Soma is here. She's editing. Then we have actually just given it to one publisher. We gave a sample of 3 chapters which they like, but they want to see the whole manuscript. Then only they'll decide. So I think we'll send it to them, and then depending on their response, if they are willing, then that is wonderful. If not, we'll try some other publishers or whatever. If it comes to that, even self-publishing. But hopefully, but it'll take some time, of course, maybe within a year or something. So, but of course, I'm hoping it'll be sooner than that. But whenever it is out, I'll definitely tell you all, and it will be a pleasure to talk more about the book. And then in between also, whenever you want, we can, have some sample chapters. We can discuss about it.
Thank you.
Thank you. Any other questions? Kindly unmute and ask your question. And Suma, I would like to thank you for introducing Doctor. I can see you've joined us. Thank you so much.
Thank you so much.
Okay.